All right. Well, thank you so much for joining us for another video. As always, my name is Roxana, UAG Med on YouTube, and I have the pleasure of having Dr. Coronado Fitts with me. She is a UAG alum who recently matched, and we are here to learn about her experience. Thank you so much and welcome.
Thank you so much. Thanks for having me.
Yay. Thank you for coming to answer a couple of my questions that I hope will guide not only me in my journey, but also my fellow classmates. So if you don't mind, I'm going to get started with the first question.
Go ahead.
Okay. First question would be a little bit more about your background. So where did you go to undergrad, and did you have a post-bac, master's, if any?
Sure. So I actually got my bachelor's from BYU, Brigham Young University in Provo, Utah. I didn't do a post-bac. My GPA was a little bit low coming out of undergrad. So what I did before I applied to UAG was I went to a different university and I took some of the classes that I hadn't done as well in to raise my science GPA. And those were sufficient, thankfully, to get me into get my science GPA up so I could apply to UAG.
Awesome. Yes,
Yeah.
Everyone's road is different. So in terms of starting UAG, did you start in August or July?
Yeah, so I actually started in January. The reason I did that is because the time that I applied, the American colleges had closed off their application season, and I found out that UAG had a fall class, and I didn't want to wait a whole other year to apply. So it was both a mixture of me and my parents just saying just go for it and start as soon as you can, because time goes by fast. So that's why I did it in January.
Awesome. Yes, I have felt the parental pressure to just
the rush.
You
do things.
You've already graduated, so let's go.
Yeah.
So in terms of UAG, when did you graduate?
I graduated just a couple months ago. So my class graduated in December 2021, but our graduation was in January. So it's 2021, beginning of 2022, somewhere there.
Awesome. And so in terms of matching, congratulations with your match.
Thank you.
Can you tell us a little bit more? Where did you match?
So I matched in internal medicine at Eastern Idaho Regional Medical Center. It's actually an HCA hospital. If you look at all of the residency programs, HCA has a lot of them. So it's in Idaho, which I never thought I would live there, but it's a match and I'm so excited. I can't wait to get started.
Yes, most definitely. So excuse me, but what is a HCA?
So it's a corporation. It's like a large corporation of hospitals. So it's a privately owned hospital, and they have multiple hospitals across the United States. And those hospitals, a lot of them offer residency programs.
Oh, awesome. So you matched into internal medicine. So
Yeah.
I was wondering if you can tell us a little bit more about that specialty, just what is IM, and also how long is the residency?
Sure. So internal medicine residency is 3 years, after which you can follow a fellowship in one of internal medicine specialties. Internal medicine covers basically everything. The way that it's different from family medicine is that it's a little bit more in depth, I would say. You can specialize into specific organ systems. So you get internal medicines are the cardiologist, the pulmonologist, the nephrologist. Anything that has an ist with an organ system behind it was once an internal medicine resident. So you take a really deep dive down into all the organ systems, pathology, and you can integrate those systems to know how to solve very large medical puzzles. So that's internal medicine. I'm super excited.
Awesome. I'm excited for you.
Yeah.
In terms of, you mentioned the different fellowships in IM, but I was wondering, are those part of your future goals, or are you thinking of staying as an internist? What are you thinking with IM?
It's a really good question because I think I also am a wife and I want to be a mother. So I really don't know what my future holds. I would love to specialize. One of the things that I love is cardiology. I would love to do a fellowship in cardiology. But one of the good things about internal medicine as well is that you can be a general internist or a hospitalist. And as a hospitalist or as a general internist, you're basically a family practitioner, but you cover a whole lot of things more in depth. So we'll see.
Yes, of course. I've heard that it's kind of like learning also what you like, right? During the residency.
Yeah. And it's one of those things, I could say like, I want to be a cardio fellow. And then in a year or two, I could be like, no, scratch that. Like, that's too intense. Let's do pulmonology or GI or something else. Like, it's all really, as a specialist, you can do so much. So really any of those specialties would give you a really good income, first of all, and a pretty good lifestyle.
Nice. And then also, you said general specialist or internist. Is that what you said?
Yeah.
Okay.
Yeah. Like an internist or a hospitalist.
Oh, okay. So the internist and hospitalist, are they the same thing or are they different?
Yeah, so I think a hospitalist is an internist, but an internist is not a hospitalist. It's one of those weird things. So as a hospitalist, you work in a hospital, right? And you can you can be one of the team members that's floating around, especially at night. Their lifestyle is really cool because you do 7 days on, 7 days off at most hospitals. An internist, you can have your own, it's more like a private practice type of person, so you have your own practice and you cover all sorts of diseases, from acute diseases to chronic diseases on the daily.
Oh, okay. Awesome. The more I learn about this specialty that I want to go into.
Yeah, it's awesome. Come to internal medicine.
Yes. Okay, so going into medical school, going back into medical school. So what were your extracurriculars during medical school?
That's a really good question too. So I actually, extracurriculars are one of those things that people will tell you have as many of them as you can. But I'm the one that's going to tell you, have a couple that you are really dedicated to. So one of the ones that I did was, my family has a nonprofit association. We take medical care to communities in Guatemala where our family's from. And so that was my main extracurricular. It's kind of like UMedic. I don't know if you've heard about that with school, but we're like that in Guatemala. And so we organize health trips once or twice a year. And I help my family oversee the planning and the carrying out of those missions. So that was my main one. And I stuck with that. And then I joined a couple other organizations like that, like UMedic, and then FM4 Paso Libre in Guadalajara was another nonprofit that I joined. So those three were it. And I dedicated myself. I've been with my family association for like 10 years. UMedic I joined for the whole time that I was in Guadalajara, so 2 years, and then FM4 Paso Libre opened my last semester that I was there. So for a semester, I went and worked and volunteered there.
Oh, nice.
Yeah.
How about research? Did you do any research during medical school?
Yeah, so I was actually answering this question before to somebody else. Research is one of those things where any research that you've ever done counts as part of your curriculum. So I did research prior to coming to UAG in my undergrad. I helped one of my mentors in undergrad publish a paper. And then while I was in medical school, I got connected with a resident who needed someone to run through data. And so that was a research that I listed on my curriculum when I applied to residency. So just 2 experiences, and that was it. I'm not a big research person, so I think that was just something to put on my curriculum that was like, okay, at least she has research experience,
Mm-hmm. Awesome. Yeah. So you did that research experience, the second one, during your 3rd or 4th year?
It was during 3rd year. It was during my surgical rotation. The person that reached out to me was a resident that was working with my preceptor at the time. And she had a friend who needed someone to run through data. And I just spoke up and said, I need that, and we met and he was like, okay, that's fine. Like, just here's the data, run through it, get back to me. And he credited me on his paper. So that helped me out.
Oh, that's awesome. That's really
cool.
So next question. Yeah. Did you have any mentors? And if so, how did you find him or her?
So I didn't really have a whole lot of mentors. I actually just have a couple that I met online. I actually met one of my mentors online on Twitter. Her name is Dr. Burgos, who you interviewed before. I met her on Twitter, and she was somewhat of a guiding hand to me throughout my whole time here in Vegas as I was doing my rotations and as I applied for residency. So she was a big one. And then other people online that have formed an IMG community on Instagram, I could give you several handles of them. Dr. Cynthia Tan is a really good one. She answered a couple of my questions. And then Dr. Nina Loom, she also has an Instagram for IMGs. And I asked both of them a couple questions as I was preparing my application and throughout medical school.
Oh, that's awesome. Yes, especially with COVID, I feel like the online mentoring is becoming bigger. And it's crazy that you knew Dr. Burgos. What are the odds?
It was one of the randomest things. I had posted something random on Twitter or had liked or retweeted something, and she was like, oh, I can help you. And then randomly we find out that we're both at UAG and both interested. At that point, I was interested in anesthesia. So it was the randomest, most miraculous thing. It was so funny.
I'm glad that it worked out. She seems like an amazing person, and
she's awesome.
Yes. I hope we could have her again for some more questions.
She's good.
In terms of step 1 and step 2 CK and OET, when did you take those?
So I took both step 1 and step 2 in the summer of my 4th year. That being said, I will tell you that was a mistake. It was really not the best thing to do. I thought that I could just jump from studying from step 1 right into step 2. And looking back, I should have studied a lot more for step 2 than I did. My step 1 score wasn't as high as I wanted it to be. And I should have really taken that into account and studied harder for step 2. But yeah, I took them the summer of, so in between my 7th and 8th semesters of medical school. And the OET, I actually took it 2 days after step 2. So it was crazy.
Oh, okay. Yes, I've heard that, step 1 before it was numerical, but now that it's pass-fail, step 2 CK is the one to have the best score you can have before you apply to residency, correct?
Yeah, basically, that's the only score that residencies will have to judge you by. So you want to present as high of a score as you can because you are an IMG. The higher you can go, take steps. One of the things that really helped me was hearing some advice on Reddit that I heard that you would score an average of your UWorld Assessment 1 and your UWorld Self-Assessment 2. And that was true for me. I scored right in between the two. And so I kind of knew going in what I was aiming for, and I was happy with what I was getting. So that's a piece of advice I'll throw out.
Yes, thank you. So that's, just to clarify, that's for step 2 CK?
Step 2 CK, yep.
Okay. Later me
for UWorld. Yeah, for step 1, what they say is the most accurate prediction of your score before, when it was numerical, was UWorld Self-Assessment number 2. Oh. So they say that you should save that till 2 weeks before your exam so that you can get a gauge of where you are. But with pass-fail, you can still do that and see if you're going to pass or fail.
Right, of course, because technically still passing is 196 now. But it'll just be pass or fail.
Quote unquote.
Yes, quote unquote. Awesome. Thank you for answering that. My next question is regarding your third year core clinical rotations. Where did you take them?
So I did all of my rotations. I actually did my core and my electives here in Las Vegas. I was drawn to the Las Vegas program because I'd heard that it was really good. I would say that it was really good, but I mean, I can answer any other questions you have, but I did them here in Vegas.
Awesome. Yes. I'll ask you a couple of questions, and then after that, you can just tell me anything that you think is necessary or important for us to know. Is that okay?
Sure. Yeah, of course.
So a fun question would be, what was your favorite core rotation there and why?
My favorite core rotation was, so in Vegas, we do internal medicine and they split it up into specialties. That was my favorite core rotation, internal medicine with the subspecialty of pulmonology. The preceptor here is, his name is Dr. Singh, and he takes the time to teach you so many things and answers all your questions, and he gives you the opportunity to really show him what you understand. But when he teaches you, he doesn't make you feel like you don't know anything. I don't know if that's the thing. He makes you feel valued for the knowledge that you do have, and he makes you feel empowered for the knowledge that you don't have and are yet to understand, you know? So loved him. It was awesome.
Awesome. Yes, that's honestly what we need as we're learning during fourth year.
Very good teacher.
I'm glad. In terms of rotations, I guess elective as well, what would you say in Las Vegas had, I guess, the least workload? And I know I say this with like, I guess the reason why I ask is because most students that I know, we try to take STEP before our third year, but it's not necessary in order to go on to our third year. So some of us decide to take it within third, or like yourself, fourth. What would you recommend in terms of rotations in order to balance both and still get both knowledge from rotations, but also have time for STEP?
Sure. So one of the easier rotations was family medicine. Family medicine was one of the ones where I felt like the schedule was pretty malleable. You know, the preceptor was really willing to work with you so that you could study as much as you want, but also gain as much information as you could. He let us do patient admissions, patient exams, but if we had a really busy day with studying, or as STEP got closer, he would let us know, okay, if you need some time to study, just let me know. So I thought that was really good if you need time to study. Awesome.
And would you agree that, say, if someone is trying to go into family medicine, to save that rotation for later in their careers so that they can, I don't know if this is the right way of thinking, but so that they can impress, I guess, the family rotations specialists to get a letter of recommendation?
I don't think necessarily. I think family medicine is one of the rotations that it's not super intense. So I think you showing up, and maybe this goes for all rotations, you know, I think preceptors for the most part really understand that you're going through a lot, especially with STEPs as IMGs. So as long as you show up to rotations with an attitude of learning and show them that you really are interested in the field, and you know, you go above and beyond during your rotation. It doesn't matter if you're there 4 days a week or, 7 days a week. They're going to take your interest and really understand you as a person and still give you a letter of recommendation that is congruent with your performance in the rotation.
Awesome. Okay. That's valuable, because I hear things online, or read things online, and it's good to hear from someone that's gone through it. My last question in terms of electives, what electives did you choose for fourth year?
So, like I was mentioning earlier, I was really interested in anesthesia. So I actually had the opportunity to open a rotation here in Las Vegas. It was anesthesia with an emphasis in pain management. That was one of my electives, and I absolutely loved it. I got to see so much in terms of pain management treatment from the preceptor. Another one of my rotations, because I was kind of juggling anesthesia and internal medicine, was cardiology. And the cardiology rotation that I did at that time required a 2-month commitment. And it was one of the hardest things I've ever done, but it was one of the most valuable. The preceptor in that rotation was super harsh. He was a no-nonsense type of guy. But I think as soon as I demonstrated that I was willing to learn and that I valued his input as a preceptor and as a doctor, he really opened up to me. And he was actually one of the ones that ended up giving me my best letter of recommendation. And I say that because an interviewer actually read back the letter to me, and I was like tearing up a little bit. It was amazing. So cardiology for sure and pain management for sure were amazing.
Okay, so my last question for in terms of 3rd and 4th year would be, what would be your advice for anyone that's trying to prepare for rotations, or just in general, like advice as a UAG student, especially now that we are mostly online. For example, I've been online for 1.5 years out of my 2 years. I've only been in Mexico for 1 semester. And, what would you recommend?
I would recommend reaching out to people that are a semester ahead of you, that are doing rotations already, because they're the ones that have the most insight into what schedules are like. It's been a minute since I've done rotations, and I'm in it like last December, so about 3 months now. Things may have changed. So things that you hear from people 2 years prior may have changed. So reach out to people that are a semester ahead of you doing those rotations to see what wisdom they can give you.
Awesome.
So you can schedule yourself better. It's all about timing with being a medical student. So learn to schedule yourself so that you can get the most out of your rotations, but also your study time.
And what about physical exams on rotations and such? Do you recommend we read up or see more videos regarding those before rotations?
You mean like actual inpatient exams?
Yeah, so that's what I've heard.
Like skills?
In terms of skills, yes.
I see. Yeah, I mean, I think watching YouTube videos helps a lot. I think what I would do if I were someone that had never talked to a patient face to face, I would practice, honestly. Practice with your family, practice with your roommates, doing a full physical exam, and then kind of break it up into, okay, like this patient presents with a cardio concern. How do I do a cardio exam? This patient presents with, a musculoskeletal concern. How do I do a musculoskeletal? I can't speak. A musculoskeletal exam or a neuro exam. Practice those exams as early as you can, so that when you're in front of a patient, you're not like, oh, I don't know what I'm doing. You know what I mean?
Yes. Okay. So it is important to brush up on those skills. For rotations.
The more confident you can be in front of a patient, the more confident you can be in front of a preceptor, and the higher score you're going to get on your evaluations.
Awesome. Oh, in terms of evaluations, you get evaluated through comments, correct? For 3rd and 4th year?
Yeah, so they give you a sheet, and the sheet has different categories, and the preceptor marks from 10, I think it goes up to 6, and 6 is a fail, if I remember correctly. 10 is obviously a high pass. So they mark you in categories like, were they on time? How well do they know clinical knowledge? How well do they interact with patients? And then at the bottom, there's a section where they can fill out comments, where they can give you feedback as to what you can do better in your next rotation or regarding that specialty specifically.
Oh, okay. Awesome. Yeah. And there's no sort of exams during no shelf exams, correct? No
shelf exams, but I will tell you that preceptors do ask questions. So even though this isn't a formal exam, the more questions that they ask that you can answer correctly, the higher they're going to grade you, the more you know your stuff, the more they're going to see that you can do things. And overall, the more that you know, the more you can do at that rotation and actually get more out of it.
Okay. Thank you so much.
Of course.
Is there anything that we missed in terms of Las Vegas?
No, I think one thing that I would mention is that all the rotations are different, and so be willing to be flexible with what you're doing at a different rotation. For example, the surgical rotation, we had to be on our feet for a very long time. And I think that goes for any place that you do surgery. In other rotations, there was a lot of downtime, where you could study. So bring study materials, but don't count on that time to study, if that makes sense.
Okay.
Like you might have to go and see a patient, so you can bring your flashcards or something like that. So you can be like doing some studying, but don't think that you're going to come to a rotation and sit down for 5 hours and study. You know what I mean?
Okay. Now I get it. Thank you for clarifying. Yeah. Yes, that was a little confusing.
Sorry.
No worries. I'm glad that you caught my blanks there.
Yeah, I got you.
Thank you. Okay, so in terms of ECFMG certification, my question is when did you apply for it, and were you certified before submitting your ERAS?
So ECFMG certification is something that has multiple components. Part of the components for ECFMG certification are your step 1, your step 2, a pathway 4 application, and the OET exam. So you actually begin your ECFMG certification as soon as you sign up to take step 1. Once you have completed all of the requirements for it, that basically it's your certification, and you just send them an email saying like, hey, can I receive my certificate at this point? Or you can give them a call, and then they just have to approve it with the school. And as soon as the school approves it, then you're good to go. What the school needs to approve it is actually your final diploma. So you actually can't have a certification until you have graduated and the school has issued you a diploma.
Right. Okay. And do you think you can speak a little bit about the 4th pathway that you said?
Yeah, it's one of the things that I really don't understand very well. I just knew that we had to do it. And you just go to this website, and I can give you the link for it. But once you are ready to apply to ERAS, you have to go to this website, and basically it runs you through all the things that UAG qualifies for, which the system does automatically for you. You don't have to know anything. So you just like, I go to UAG, yes, I've taken my step 1, yes, I've taken my step 2, and then it shunts you. So it's like, you are eligible for a pathway 4 application. So what I did was I called UAG, and I made sure that was the application that was correct, just in case I had made a mistake at some point, and they said that it was. So I went back to the website, I said yes, and then you just have to pay a fee, and that's it. That's all you have to do for it.
Okay, awesome. Yeah. Awesome. No, that was more than enough, because I've heard of the pathway system, but I guess I misunderstood, and I thought that we were no longer doing pathways. But since you recently just went through it, we have pathway 4.
Yeah, we have a pathway 4, but that might change. The pathways really were a way to figure out what to do, because step 2 CS got done away with, Wow. So as a way of saying, okay, this applicant has clinical skills, that's why pathways emerged. It was basically the school saying we do grade them and examine clinical skills, and I think UAG does that, so that's why we qualified for which at this point is pathway 4.
Oh, okay, that's awesome, because I didn't know what that meant either. I just knew it somewhat existed.
It's confusing, but that's all it is. It's not as confusing as it is.
Yes, awesome. Thank you. So next question is more about ERAS, and how many schools did you apply to?
So on my initial application, this is going to shock you, but I actually only applied to 30 programs. There is a lot that I have to explain for that, so I'm going to wait for your other questions for that. Okay. But I only applied to 30 programs, and I regret it. I think I should have applied to a whole lot more. Most people are counseled to apply to at least 100 to get good exposure But I mean, that's up to your discretion. If you have really high scores, the chance that you get in a program are higher. So if you have lower scores, you want to apply to more programs. If you have really high scores, don't apply to just 5 or 30 like I did, but you don't have to necessarily apply to 100 every time.
Oh, okay. My next question is, how did you find what residency programs to apply for?
So I used this tool called Frida. There's a website for it as well. You can register for Frida if you have an AAMC account, which you should have if you've taken the MCAT, which all of you have. So you should have an AAMC account. You go into the AAMC website and then you search for Frida, and it's a database basically that has all of the programs, and you can select by specialty, and then you can sub-select by location, and then you can see all the programs that are there. I would really recommend it because all of the information is there. You can evaluate each program. And I think for me specifically, I was limited in where I wanted to apply because I wanted to stay here in the West Coast. And so that kind of narrowed down my my search field, I guess. But you can make your database as wide as you want to. And I would just say have an Excel spreadsheet and then start putting in things that are important to you. And that way, by the time ARIS comes, you have your 100 programs down.
Awesome. Okay. Next question is, what do you know about the SOAP and scramble process?
Yeah, so I'm glad you asked that because I actually matched through SOAP, which is a wild story. I would love to tell you guys more about it. Basically, the reason why I feel like I shouldn't have applied to just 30 programs when I did is because it didn't give me that wide exposure that I needed because of my SEP scores. My SEP scores weren't awful, but they weren't what I wanted them to be. And so I never received any interviews. And for that reason, I couldn't submit a rank order list. A rank order list is the process that you go through to rank the programs where you have interviewed. But if you don't receive any interviews, you can't make a rank order list. So I actually just went through the SOAP system, and the SOAP is basically all of the programs that have remained that have spots open to match. Once people have matched on Monday of match week, that list goes out to everyone that hasn't matched, and you have a chance to filter through all the programs and see which programs you can apply to. You have 45 applications, you send those in, and then you wait for interviews, which actually is kind of nice because you find out pretty quickly where you're going rather than having to wait for a couple of months. It is stressful, so I don't recommend it, but you go through your interviews, and then on a specific day, this year it was a Thursday, they have 4 rounds of offers where you can accept or reject a program where you have interviewed during the SOAP week. Once you accept an offer, it rejects any other offers that you have. So you are counseled to accept offers within the first round if you get offers then, because chances that you have another offer incoming decrease every single offer round. I don't know if that was specific enough. You probably have questions.
Oh, yes.
Tell me. It's complicated.
Yes. So, well, first of all, I'm really happy that it worked out for you because I've heard that SOAP is just intense. It's within those 3-4 days. And, the amount of time that it takes for you to, I believe, change your personal statement. I don't know if you changed your letters of rec, but I've heard that that's also a possibility. And just getting this information from the different school programs available, I'm really happy that really happy that it worked out for you because matching is just intense. Stressful. Yes, no, and it's just as USIMGs, we don't have great stats in terms of matching, so SOAP is one of those things where so I can tell you a little bit more about what I did to prepare because as of February of this year, I knew that I was going to have to go through SOAP if I wanted to get a position this year. So I
over prepared for soap. I changed all of my personal statements. I made personal statements specifically for the 5 categories of soap that are most unfilled. And I can share those. It's family medicine, internal medicine categorical, internal medicine preliminary, then transitional year, and general surgery preliminary. So I made a statement for each of those specifically for soap. Oh, wow. And even then I made a couple of extras for places where I knew I wanted to go. So for example, I'm from California. In my soap internal medicine California personal statement, I listed different things than I did for my soap general internal medicine. Does that make sense? So I made specific changes according to where I was going to send the personal statement to. My letters of rec were the same every time. I asked my letter writers to be a little bit more broad as far as what they were recommending me for, because I knew that I wanted to apply to internal medicine, family medicine, and back in the time when I asked them for it, I thought I could use these letters for anesthesia as well. So I was very strategic in my thinking of what do I ask my letters of rec to say? How can I present myself to this program that is going to have, 30 minutes to interview me, to like sell myself that I need a position. So I over prepared. And then Monday of match week, when that list was unfilled, I spent the whole day researching everything that I could, because you only have 45 applications and there's more positions than 45. There's more than 45 programs that have open spots. So I spent the whole day reading and rereading, and I went into websites. I created a specific spreadsheet for just soap. And so by the time that I submitted my 45 applications, I knew that if I got at least 5 interviews for those 45, I would be pretty comfortable saying that I got an offer, So just preparing was my key.
Okay. Well, wow. I'm glad. Yes, I have heard in the past that, to go into match day, you're supposed to be prepared for these difficult decisions and thinking, for example, you like thinking, am I okay with changing my like career path essentially, right?
Yeah.
And it's difficult, but it's one of those things, but you really prepared yourself. I'm really glad that I guess I should do that too.
Yeah, and I would recommend to prepare for that eventuality to anyone, because those 5 categories of residencies have been the same historically for the past like 5-6 years. Mm-hmm. So if for any reason you actually don't match on Monday, that those 5 categories are categories where you have a chance of getting a job. And really, that's all that medical school is, right? Your whole goal throughout medical school is to obtain a residency. So, by January of this year, I was like, okay, I need to figure out what I want to do. And by that point, I had already had my cardio rotation, which showed me that I really liked internal medicine. So I was like, actually, this is a great career path for me. I'm going to go for it. And the fact that internal medicine is one of those 5 categories that's always open was really helpful to me at that point.
Yes, I'm glad. So did you match into categorical?
Yeah, I did actually. So I ended up applying to only like 3 preliminary internal medicine programs because there were so many categorical spots open. Mm-hmm. And a categorical position is more desirable than a preliminary position. So at that point, I was like, I need to put more eggs in this basket. You know what I mean?
Yes. So the difference between categorical and preliminary is just that if you finish your intern year preliminary, you have to reapply matching for a categorical position, but now you would enter as a year 2. Is that correct?
Yeah, that's correct. So preliminary is a 1-year program. A categorical position is a full education in your specialty. So categorical positions are in everything, you can have a categorical anesthesia residency, you can have a categorical family medicine, and a preliminary programs really could just be in medicine and surgery. So.
Oh, okay. And then, well, since you mentioned transitional year, can you explain what that is?
Yeah, so transitional year is really similar to a preliminary year. Some specialties require that you have an intern year prior to becoming whatever you want to become. And those whatevers are ophthalmology, dermatology, radiology, I believe, requires an intern year. And I think there's a couple others, but a transitional year is a year that's a little bit more broad than a preliminary year. A preliminary year, usually, like I said, is either in medicine or surgery. As a transitional year resident, you can do medicine and surgery and, other specialties, which I think as a prelim in surgery or internal medicine, you're a little bit more limited to either one of those things.
Oh, okay. Awesome.
Yeah.
And in terms of UAG, did you need them for any part of the SOAP process, or like did they play a role?
No, they don't. So that's all on you. Really, UAG with ARAS and Match is really hands off. But I think that that's pretty general for any medical school. They want to support you, but they're not. You can't call anyone. And that's actually one of the rules of SOAP is once you submit your 45 applications, and you cannot contact the program at all until they contact you. And you contacting them is actually a violation of the rules, and you can get flagged and you can get excluded from matching in the future. So it's a really big deal.
Oh, okay. Well, I'm glad that the names or the list of the programs were given through the NRMP process.
Yeah.
Yes?
Yeah, so it's the same place where you do your rank order list and you apply. No, you apply through ARAS, but the same order where you do your rank order list is what releases the unfilled programs. And like I said, this year we had from 9 a.m. until 8 a.m. So 9 a.m. on Monday to 8 a.m. on Tuesday to submit 45 applications.
Oh, okay. Awesome. I was imagining that you needed UAG to tell you what schools are available. And, right now, because I'm on Twitter and stuff like that, I'm like, how would I contact UAG? Do I need a phone number? I want to get those phone numbers if I need a contact, but thankfully it's available.
It's available, and it's available right away. And I think at that point, it's just up to you to know where your best chances are.
Awesome. Is SOAP the same thing as Scramble?
So they're kind of used, the terms are kind of used interchangeably, but from what I learned this year actually is that Scramble is actually post-SOAP. The SOAP is still considered matching. So the Scramble actually comes after SOAP because after you SOAP, there's still programs that remain with positions unfilled. So at that point, when Match recloses, the Scramble is, okay, they release all the programs that are still unfilled, and you then have to contact each program directly. It's not an application like it is with SOAP. It's you calling the program and saying, hey, my name is, Anna Smith, and I'm looking for a position with your program. I see that you have an unfilled spot, give me a job.
Yeah, okay, awesome. I wasn't sure either, and thank you for sharing what you know about SOAP and Scramble. Okay, so in terms of successfully matching into residency, how important do you believe UAG grades are?
So they're important, and they're important because when you are applying, one of the requirements for your ARAS application is this document called the MSPE. The MSPE is basically a rundown of your whole time as a student, and that's separate from your transcript. The MSPE is more of a narrative of who you are as a student. And as far as actual grades from year 1 and 2, I'm not sure. I think those only go in the transcript, but the MSPE, it's all of your evaluations. And those evaluations come from preceptors that you visited, right? So I think I've mentioned this to a couple of people, every time that you go into an evaluation for a rotation and your preceptor gives you back your evaluation sheet, you're supposed to keep that evaluation form because you are going to use all the comments that preceptor put in to fill in your MSPE. So they're important to a point, I would say.
Awesome. So,
Does that make sense?
is the MSPE in a essay format?
Yeah, so it's various paragraphs where you can UAG asks you to like write in what happened during that rotation, comments that your preceptor put, and then they use that to like put a graph about your performance, and that compares you to other students. So you put in like the comments from your preceptor, but then based on your grades, that gets put in a graph, and they can see where you are compared to the rest of the students.
Oh, so would this graph be in regards to year 1 and 2, or the numerical score of 6 through 10 that you were speaking about earlier?
I think it's a numerical score, if I remember correctly, 6 through 10, and then I'm pretty sure your grades from years 1 and 2 just go into your transcript. But your transcript is something that residencies also have access to. So of course, the better you do, the better your transcript will be. They tell you that you can't see your transcript. That's not something that they will release to you. But obviously, if you were scoring 9s and 10s in years 1 through 2, you're gonna look better on a transcript than if you were scoring 7s and 8s.
Gotcha. Okay.
Yeah.
In terms of letters of recommendation that you mentioned earlier, how many did you obtain, and when did you ask for them?
So I got 4, and like I mentioned, I asked them to be a little bit broad. I told them that I was applying into internal medicine with family medicine as a backup. But I asked for them as soon as my rotations were over. So from the first rotation that I went to, I formed a relationship with the preceptor, and by the time I left, I was like, hey, if I need a letter when I'm applying to residency, would it be okay to reach out to you? And most preceptors will say yes, especially because you don't want to ask someone that you didn't form a relationship with, so that speaks to you as a person. Like, form a relationship with your preceptor so that they will say yes. And so I asked right away, and then as soon as ERAS was coming around, ERAS for us this last year was opening, I think it was in September. So I asked my preceptors for the letters late July, beginning of August. And I prepared some stuff to give them. I gave them my curriculum so that they could see. And then some of them will tell you like, okay, tell me a couple things that you want me to write so that I know how to personalize a letter for you.
Oh, awesome. So just to make sure that I understood.
Yeah.
You asked at the end of your rotation, kind of saying, I would appreciate it if you write me a letter of recommendation when the time comes. And then when the time came, you emailed them or something. Is that correct?
I didn't email them. I went personally and I asked. And that's something that I'll tell you, a lot of people are like pretty vague about it, but I feel like people that are thankful really make it far. So I, like, during the year, I would try to keep in contact with those preceptors, and by the time that came, it wasn't weird for me to just show up at their office and be like, hey, give me a letter. It was like, oh, hey, Crystal, how can we help you this time? And it was like, hey, I actually need a letter. Like, would you help me? And then it wasn't odd that I was showing up to their office just like asking for something.
Right. Yes, it's so valuable to kind of plan ahead. Like, okay, I'm going to get from this person, right? So you just keep in contact.
Yeah, and that's one of the things that I'll tell you for rotations as well is write thank you cards. Like, they go a long way, further than you think. Just like take a couple of seconds to jot down a few words for your preceptor and thank them for their time, because they're taking the time out of patients that they could be seeing, which is money they could be making, to teach you. So like, just being thankful, I think for me at least, it took me far in the sense that they were willing to help me at the time that I asked for help.
Oh, okay. That's a great tip. I will take.
Yeah.
I'll definitely do that. Okay. In terms of ERAS, so I know that there's a hobby section within the ERAS. I was wondering if you could tell us how many hobbies or what hobbies did you put in your ERAS?
I put, this is really funny because I feel like most people will tell you that you can't put like regular hobbies, like reading is something that's super common that people list, or like, I don't know, dancing is something that a lot of people, or like cooking or traveling, you know. So I think I took a deeper look into myself, and I listed Mayan archaeology because I'm from Guatemala, and my husband and I have actually gone to all the Mayan sites, and that's one of the things that we really like to do, is like look at my heritage and explore it, and we watch documentaries about it. So I listed Mayan archaeology as one of my hobbies. And I said, you know, I'm Guatemalan and I really enjoy learning about my culture and my heritage. And it's one of the things that I love. But that being said, I was prepared for questions about that. You know, it's like, don't just put Mayan archaeology if you know nothing about it. Right. I also put like outdoors things. And then I said, you know, I'm kind of a jack of all trades. I like tennis, I like hiking, I like running, I like all of these things, but I group that into outdoors activities rather than saying, I like running and I go to the gym, you know what I mean? So you make it more tailored to you so that they're not like, okay, this is another girl that likes to cook, you know?
Right. So you personalize it because you can write like a little bit about it, right?
Yeah, and like I said, I think one of those things is encompassing a lot of them into one thing, so that they can see that you're diverse and that they can see that, okay, besides Mayan archaeology, this girl's not just a nerd, you know, like, but she actually likes being outside and she likes doing other things that are not just one thing.
Right. Oh, awesome. That's really cool. Your hobbies.
Yeah. You have to be really smart about these things, you know? They're going to ask you questions, so be prepared. And I think one of the things I listed too in my outdoors activities was like, a lot of people that read your application are old Caucasian men. So you have to think, you know, what is something that could relate to them, you know? And one of the things that I started doing was playing tennis, which a lot of old Caucasian men do. And I'm starting to ski. My husband started teaching me to ski, which is something else, you know? So I threw that in there. I'm undertaking skiing. I'm learning to be a tennis player, you know?
Awesome. Yes, thank you for being for thinking about that, because you're right, we have to think about who is going to interview us, who is reading our personal statements, and be somewhat relatable, but also being genuine
yourself.
To who we are, right?
Yeah. So I think I read somewhere on a blog post that someone had included like Harry Potter, and they were like, don't do that, like they're just gonna see you as a kid. As much as we all love Harry Potter, like maybe don't say that right off the bat, you know what I mean?
Oh wow, that's interesting.
Yeah.
Well, okay.
So funny.
Yes, that's funny. It's something that I don't think I would have thought of, you know?
Yeah.
But all right, thank you. In terms of also ERAS, did you put any certificates down?
I did. So I put down, I don't know if you guys have to do this still, but UAG does a research class. I think it was 10th semester. And my group got second place in one of the, in the event, you know? So I put that down that I had gotten, you know, a certificate of winning second place in research day. And then I put down the Harvard HMX courses, which UAG also has the option of taking. So I put the two that I took. I think I took pharmacology and physiology. So I listed that each as a separate one. And I think those were all of my certificates in there.
Awesome.
Yeah.
I'm in block 10 right now, and I'm also doing the research, but I wasn't aware that we were being graded like that. So I'm glad that you mentioned that.
Yeah, I don't know if they still do it, but they did like a whole thing for us. It was like a ceremony, and they presented us with a certificate, and like we got like a mug. So I was like, I'm gonna list that. That's
awesome. Yes, of course. Congratulations.
Yeah. Thanks.
Okay, so I'm nearing the last two questions.
Sure.
One of them is, what do you think helped you successfully match?
Honestly, it was a lot of preparation. Like I was mentioning earlier, you know, I think only you know your application as well as anybody else. You know, you can give your application to someone to evaluate it, but I think being honest with yourself about what your chances are of the specialty that you're pursuing will help you to be prepared. And I think preparedness is key. Like, I spent a whole day researching programs, you know, so like, and before that, you spend like months looking at programs to see where you're gonna apply because you're investing money. So be honest, be prepared, and just try to bring positive vibes into your environment so that you can deal with that sometimes harsh honesty that you have to face as a medical student who's an IMG.
Awesome. Yes. And last question would be, what do you recommend UAG students to focus on?
I would recommend you to focus on residency. I think that if you keep that goal throughout your whole time at UAG, you're going to do the right things so that when the time to start your residency application comes, you will be prepared. If you go into medical school thinking, oh, I'm going to be a medical student, you're going to fail at getting into residency. Whereas if you come into medical school thinking, this is a time that I have to prepare to be a doctor, and to be a doctor, I need to be a resident, you're going to do the steps that are required to become a resident. So remember your end goal.
Awesome. Yes. Thank you so much for, your time and for explaining things in a way that we'll understand. And again, congratulations on your match. And
Thank you.
Also, I guess I'll say it now, Dr.Coronado Fitts was very, very helpful and thoughtful and proactive in creating a document for all of us current and future UAG students. When the document is finished, I will post it within the description box, and hopefully you can download it, but also I will be distributing this document that Doctora has been creating. If you can you please explain a little bit about what this document holds?
Sure. So the document, I'm calling it the UAG Bible because I feel like a lot of us come to medical school, specifically to UAG, with high hopes, but not a lot of reality. So I wanted to be sure that future generations know, one, the cost of what you're getting into, and two, what you can do to find help. Because I think that throughout my time, there were a lot of times when I was confused and I didn't know who to reach out to, who would help me. And I don't want you all to go through what I did. I hope that this document will help you know the right people to contact when you have questions, if those questions aren't answered within the document itself. It lists a lot of pathways that I think are helpful to do. And if you're on that pathway that I described, you're going to get to the place where I am, which is into a match residency. And like I said before, you know, your goal is to obtain a residency. Your time at UAG is 4 very short years. They might seem like a long time, but they go by faster than you think. So looking at your end goal, and I think this is what this document does, is helps you look at the end goal of why you're at UAG. So I hope it helps you all, and I wrote it with so much love and so much care for people that were once in my shoes. So I hope it helps you all.
Yes, thank you so much. And if you all read this, read the document, and you would like for Doctora to come back with us, she has offered, I'm not just telling you that she's available, she has offered to come back and go step by step, year by year, answering any questions that you might have, and we can create it into a video. But for now, thank you so much for your time. Congratulations on your match. I am super excited for your journey, and follow Doctora on Instagram. I'll leave her description, her handle in the description box below. And yeah, have a wonderful day.
Thank you.